Kicking us off is Ben O'Mara and Kaye Stevens with their presentation, Developing Information about End-of-Life Care and Motor Neuron Disease, Lessons Learned from the United Kingdom and Australia. Get ready to post your questions for Ben and Kaye in the Q&A box on the video screen.
Hello, Kaye Stevens here, Care Information Manager at the MND Association for England, Wales and Northern Ireland. It's an honour to be presenting at the Allied Professionals Forum and especially in collaboration with Ben O'Mara from MND Australia. I first presented here about our end-of-life guide in 2014, shortly after its launch. And years on, it remains one of our most valued guides, and I think a short summary will help set up Ben with his content later. In the lead up to the development of our guide, various UK studies about end-of-life care funded by the MND Association enabled over 500 people with MND ALS to contribute their views on end-of-life decision-making. And we also received input from carers, families and the health and social care professionals that were in support. Two clear needs emerged. One was to be better informed about end-of-life decisions, and the other was to have more opportunities to open difficult discussions about end-of-life care, especially with the professionals that were providing support. Existing end-of-life resources tended to come in small bite-sized pieces at that point, which was a valid approach. However, it felt as though organisations were possibly wary of tackling the subject as a whole, and collating all of that information together felt a bit like a work project at a time when families just needed the guidance and support. The result was our comprehensive end-of-life guide. It's still available in separate sections on our website in case anybody does want to tackle it in small pieces, but it has plenty of cross-referencing between all of the sections so readers know where to go when they need more. And that can help them to understand how one decision can impact on another because end-of-life care is so complex. And of course, it's still available as a full guide, either online or in hard copy. And throughout, sensitive subjects are explored using clear, active language. A palliative professional described the guide as a breathtaking, honest and comprehensive document that shies away from nothing, written in a frank and compassionate way. And being candid gives people permission to open difficult conversations. Emotional conversations, yes, of course. But if information can unlock distress and questions, surely it also has the potential to be able to provide answers and to help reduce fear for people. And this helps to meet the needs of being more informed and being able to open those all-important discussions. Professionals certainly respond well to the guide, demonstrated by feedback from one reader who said, "I have had to give away my personal copy 3 times to health professionals." Our end-of-life guide was awarded Patient Information Resource of the Year in 2015 by the British Medical Association, and we followed that with a successful formal evaluation of the guide in 2016, looking at data, usage, feedback and information coming through on our wider MND Association surveys. Since then, the guide has continued to help people with MND ALS navigate end-of-life decision-making, and bearing in mind that only 5,000 people will have MND ALS in the UK at any one time, and only some of those will be ready or wish to seek end-of-life guidance, the access to this content is quite surprising. Even in 2020, when lockdown diverted so much focus to coronavirus, we still saw more than 1,400 downloads of our section in the guide on what to expect with the disease, and another 1,600 downloads on the section How Will I Die? In 2021, we've seen a 25% increase on those figures, and of course, hard copy, printed publications going out as well. Following a user-led and professional expert revision on the guide, we now plan to also produce a short summary which will help to prompt people to start thinking about their end-of-life decisions and then lead them to the fuller guide when they feel ready to read more. We're always delighted when other countries want to adapt our work. We've successfully collaborated across the globe and sometimes repeatedly, as with Argentina. But the request from Australia recently to use our end-of-life guide as a starting point for their own development has been a valuable exercise for us too. And that feels like a very good cue to hand across to Ben with our congratulations on their amazing work in producing targeted end-of-life information for their own target audience.
Thank you, Kaye, and hello everyone. Before I begin, I'd like to acknowledge that I'm recording this presentation on the lands of the Ngunnawal peoples, who are its traditional custodians, and pay my respect to all Aboriginal and Torres Strait Islander peoples who may be watching this recording. My thanks to David Ali and the Forum Committee for the opportunity to speak with you all today. I'd also like to thank Carol Burks and Ruth Quaken, my colleagues at MND Australia, as this presentation is based on work we have performed together, and it would not have been possible without them. I'm going to be talking with you about the development and distribution of the recently published End-of-Life Care, a guide for people living with MND. I'll be focusing in particular on how we adapted a guide that is accessible and sensitive to the needs of people living with MND, the ways we're encouraging health professionals and others to share the guide, and initial outcomes and feedback from the MND community here in Australia. Kaye has done a wonderful job of describing the MND Association's excellent guide, so I won't be going over things she's already said. But I just wanted to highlight that in Australia, similar to England, Wales and Northern Ireland, evidence suggested the need for a guide to end-of-life care and MND. We responded by developing our guide and to better support the MND community here. I'd like to thank Kaye and her team once again for their permission and advice throughout our guide's development. I'm also going to be sharing with you the value of our National Shared Services model and the lessons we learnt from the MND community. We feel the adaptation process undertaken has been a viable approach, which has led to the development of a useful, easy to read and comprehensive guide to end-of-life care for Australians living with MND. The development of high-quality, evidence-based and best practice information is a key part of our work at MND Australia. We work within a shared service model to coordinate the Information Shared Services Group, which is a team of people who work in education, management and information roles at the state MND associations and MND Australia. This ensures that the development of information is guided by the needs of those impacted by MND across the country. As a member of the International Alliance of ALS/MND associations, MND Australia attends the annual Alliance meetings. A few years ago, a presentation from the MND Association of England, Wales and Northern Ireland on their publication, End of Life, a guide for people with MND, highlighted an opportunity to partner and adapt. Around the same time and through the Shared Services Group, we were informed that the MND associations were expressing an increasingly urgent need for more information for their members on palliative and end-of-life care, particularly in light of the introduction of voluntary assisted dying in some states and ongoing discussion in others. The group therefore agreed to start work on addressing this major gap in our information resources. After reviewing national and international evidence, other resources and information, the group also agreed to follow an adaptation process and to draw on the MND Association's guide as a basis for our work. We gathered feedback from the state associations about what may best meet the needs of people living with MND and their carers and loved ones, including how to best build on the MND Association's guide. The feedback by the Shared Service Group suggested that a print-based resource that closely followed the structure and information already developed in the MND Association's guide was needed. Members of the group, however, suggested that we needed to follow our own ease of access guidelines, including imagery. On the screen, you can see some of Australia's accessibility guidelines and legislation, which help us to ensure content, imagery and use of plain language was tailored to our readers. Following this initial draft over the course of roughly 8 months, we developed a first draft, which you can see on the screen featured images, simple language, plenty of white space, colour coding and clear headings to make it more accessible and easy to read. The draft guide was then shared with a group of health and palliative care professionals, people living with MND and past carers for them to review and provide feedback and suggestions for changes and improvements. We'd like to acknowledge at this point that feedback gathered was from a relatively small group, however it did highlight important features that could be addressed to improve the quality and effectiveness of the guide. Generally, the guide was described as useful, valuable, good, great, excellent, and was considered sensitive, reassuring and friendly, as illustrated by this quote from an allied health professional. Wow, I must admit, before opening these resources, I was afraid to read them, but what a tremendous job you have all done in making this information on a highly sensitive, scary subject so gentle and reassuring. Some were rather moving and actually gave hope and offered control back. The specific suggestions for changes were that some words and language could be changed to make the information easier to understand and more sensitive, friendly and less clinical, that we needed to better address the mental health needs of readers. It was suggested that some sections could be improved by changes to the spacing of words, font size and navigation system to make it easier to read and find information. And as highlighted by this next quote, we needed to soften the use of the words end of life and reduce its use in headings. The participant said, overall, I thought it was a good, honest approach to information giving about end-of-life care, given sensitively and with care. I've commented on some language used that may have been a bit jarring or strong. Sometimes the use of words end of life felt a bit harsh and could be softened. So while the guide was generally found to be acceptable, there were clear opportunities for enhancement. As you can see from the current version of the guide on the screen, significant changes were made. We worked with a graphic designer to include colour coding and a mix of stylised images and photos. We reduced the text in headings as well as the headers and footers to make it much easier to find relevant information. This step also helped reduce repetition of the words end of life. Some sections were rewritten to make them less instructional and to encourage a greater sense of reader choice to support them with decision making. Examples of ways to reduce stress and help support overall mental health that were more relevant to daily life were added as well, and we ensured that there was information and links to more services and resources. We developed a clearer, more minimal format for the table of contents and colour-coded dividers between parts, and an index was added to help readers quickly find the information they're most interested in to read when it suited them. Once changes were complete, the draft guide was reviewed by MND Australia, the Shared Services Group, and other MND Association staff. Following final review and approval, the guide was printed and made available online in late April of this year. The next step was to develop a plan to distribute, evaluate and support use of the guide. MND Australia and the state associations agreed on a sensitive but steady approach to promoting and sharing the guide with the MND community. The general idea is to make sure people don't feel confronted or experience unnecessary stress as part of thinking and talking about end-of-life care, but to also make sure that the guide is available when needed. The guide can now be ordered from the state associations in its print form and found online at www.mndconnect.org.au. The aim is to enable health professionals and MND Association staff to sensitively share the guide with people living with MND during conversations if and when the person indicates they want to discuss future care and are ready to read the resource. To date, the guide has been shared as part of a webinar for the state associations on what helps with conversations about end-of-life care, selected for profiling through Health Direct, one of Australia's most well-known sources of health information, shared by MND Australia's social media and online through a blog, distributed to the MND clinics across Australia, used by people living with MND, their carers, loved ones, health professionals for information and for linking to services. As part of our plan to monitor the effectiveness of the guide, we've included feedback forms in the print version with a reply paid envelope, We'll also be seeking review and feedback from those accessing the guide online. Initial reporting through the Information Shared Services Group suggests, and from what they've learned from speaking with people living with MND and those supporting them, is that the guide has been positively received. More copies of the guide have been requested and it has been used to access palliative care services. The guide will also be a focus for an upcoming education session with people living with MND in Queensland. Given the evidence from feedback we've collected to date and the reports from MND associations and others working with people living with MND, we feel that there are three main lessons from our development of the guide. It is possible to support discussions about end of life in the MND community in Australia with an adapted and tailored information resource developed from the evidence and existing best practice resources. The adaptation process itself has revealed it's important to develop information for people living with MND in Australia that is evidence-based and involves input from those living with and impacted by MND, and that the information needs to be easy to understand and to navigate and be friendly, comforting and sensitive to the needs of people living with MND. And we've learnt that future development will evolve based on learning from those using the guide. At this point, we see a number of valuable opportunities to enhance availability of the guide and to support its use. The recently launched MND Connect website can share the online version widely and help build awareness of MND Australia's work supporting the community. Future training and professional development activities and events hosted by MND associations can allow us to introduce the guide and support its evaluation and enhance our relationships with those agencies. The Information Shared Services Group will be able to monitor reports from the state associations about use and acceptability of the guide to guide future updates and enhancements, be the basis for future conference presentations, publications and funding submissions to help develop the guide in other formats to widen its availability and accessibility. Finally, there may be opportunities to use the guide to help shape clinical guidelines, policy change and debates about care at end of life, and through this keep supporting the voice and rights of people with MND for sector-wide improvements. Finally, I'd like to acknowledge the work performed on the guide by the following people, which was essential to its development. The state MND associations, and especially I'd like to thank past and present members of the Shared Services Group, people living with MND, past carers, allied health and palliative care experts who were involved in reviewing the guide and providing valuable feedback and guidance, the MND Association of England, Wales and Northern Ireland for so generously sharing and supporting us through this adaptation process. We'd also like to thank volunteer Emily Mac-Isaac for her work on the guide, Joe Kohler and the team at Michelle's Warren Public Relations and China Shop Design. Thank you once again, everyone, for your time.
Thank you so much for that really interesting discussion, and that it is a really difficult topic to bring up with people. So to put it in such a nice, not nice, but like in a clear, concise way, and something that you can actually use. I mean, that's really excellent for people. Was there anything that you found? Was there anything that you were surprised by when you were putting it together, or people's responses back?
Is that question directed at me first, or does Kaye, would you prefer to comment on that first, just given the sheer amount of work the MND Association you work for has performed on the guide?
I think for us, the most surprising thing in the UK has been not only how people with MND and their carers responded to the guide, but also palliative care professionals who literally were queuing and wanting to order or purchase the guide in bulk to train their teams, and not just for MND. It was for palliative care services in general. So we've had to be quite careful in how we sort of manage that demand because we're a charity. So it's been tricky, but it has been, I think, a revelation that just pulling all of that end of life information together into one core guide is something that just simply hadn't been done before. and has been incredibly useful and valuable as an exercise wider than simply even the MND community.
And if I can just jump on to the end of what Kaye was saying there, I think because of the best practice, evidence-based approach that Kaye and her team have taken with the guide, that then gave us, I guess, the team at MND Australia and the Information Shared Services Group, a degree of confidence in going forward to talk about the guide with people living with MND, past carers and people, staff at the associations. And then I do believe we saw a very similar reaction from those people who were involved in its development and now that it's in the community. In terms of surprise, I mean, from my perspective, being relatively new to this field, I was a little surprised at, to a degree, how well the guide was received. But I just want to emphasise that's because of the evidence-based approach that Kaye and her team took and the specific techniques that we used, i.e. practical and friendly, being upfront, these sorts of, and the navigation system. I think those things helped in the reception of the guide. But I also just want to flag too that we're still monitoring, gathering feedback, and I'll know more about, I guess, in a robust way, how people feel about the guide now that it's out in the community, a bit later down the track.
And are you also finding the palliative care connection that people are reaching out to you as well?
What I do know is that what the reports back, so the way the Information Shared Services Group, so we work as a team, and we meet regularly during the year to discuss what staff, information and education professionals at the associations are experiencing when they talk with people living with MND and when they talk with services. When you say palliative care professionals, I do know that health professionals are requesting the guide, and it's being viewed positively. When it comes to palliative care professionals specifically, I've had a little bit of anecdotal feedback from a couple of palliative care professionals that yes, it's good in terms of it's an effective resource, but I think there's more work that needs to be done there to learn from the palliative care community more broadly. I just want to flag though that one great outcome, and again, this is only one story, but there was a report back from MND New South Wales that a person living with MND used the guide to access palliative care services. I think that's very heartening. I just wanted to flag that. So not about a palliative care professional specifically, but I think that's an important anecdote to share.
I think from a perspective of the International Alliance, I thought the background that, you know, the MND Association, you saw that it got carried to Australia, but you changed it to meet the needs of the people specifically in your country. I'm, of course, very interested to see where this goes next and who picks up on it next. But I think it's, I mean, it is an amazing amount of work that both of you and your organizations have done, and it's a fantastic tool for people to use.
Yeah, thank you for the kind words, Sarah. Kaye, if it's all right, can I just jump in with something Sarah said there, unless Kaye, you have something specifically you wanted to? I just want to say in terms of, yeah, Sarah, continuing to learn from this process. I do want to flag that MND Australia and with David Ali and the team there, that we're building on the work of MND Australia and going in some new directions. Some of those new directions do involve trying to engage with some of the changes that are happening across Australia more broadly in terms of voluntary assisted dying, and different states are at different stages of dealing with those changes. So we're looking to obviously keep learning from the MND community more broadly about the Guide to End-of-Life Care and how we can improve it and make it more accessible. But due to the ongoing policy and legislative changes, I mean, we're just trying to engage with that legislation and understand how we can best support associations to deal with those changes. And some of that does relate to how information is shared. So I guess in terms of watching this space, Australia is a very important example on the international stage, not to dismiss or to, I'm not saying that other countries aren't important, they're just as important, but right now there's a lot of change happening. So hopefully I and we, the team, can come back to you, Sarah, with a bit more insights for how we've changed or modified the guide to help support legislation and support the associations.
That is excellent. Yes, we will look forward to that. All right, and I think that wraps it up for this session. Thank you so much. That was excellent.